First, this is Public Health and Safety Committee. We do have a quorum with myself, Vice Chair Huffman, Council Members Benton, Bradford, Gregg, Nash, and Prepty. Oh, and now Porterfield. We have extra quorum. I do have a proposed consent agenda, but before I do that, I will say that we did not have anyone sign up for public comment, so we don't have anyone who needs to move forward with that. So we'll go ahead and I'll read the items for the proposed consent agenda, and then if there's anything that anyone would like to pull off, then we can address that. First item on the proposed consent agenda is item number 1, and we have item number 2, 3, 4, 5, 6, and that's it. Does anybody want to pull any item from 1 to 6 off the proposed consent agenda? I am seeing no hands, so I'll go ahead and read, and then if the spirit moves you, we can pull something off after that. First item on the proposed consent agenda is RS 2025-1109, a resolution appropriating to a certain account for the benefit of the hospital authority in the amount of $10 million. Sponsors Porterfield, Evans, Welsh, and Gadd. Second item is item number 2, RS 2025-1111, a resolution appropriating a total of $355,000 from a certain account of the Community Safety Fund for grants to various nonprofit organizations for South Nashville community safety programs. Sponsors Porterfield, Evans, Welsh, and others. Item number 3, RS 2025-1112, a resolution approving amendment number 1 to a sole source contract between the Metropolitan Government of Nashville and Davidson County and the Village of Glencliff to increase the value and extend the term of the contract. Sponsors Porterfield, Evans, Welsh, and others. Item number 4, RS 2025-1116, a resolution approving amendment 2 to a grant from the Tennessee Emergency Management Agency to the Metropolitan Government acting by and through the Office of Emergency Management to provide resources for hazardous materials or hazmat preparedness. Sponsors Porterfield and Evans. Item number 5, RS 2025-1117, a resolution to approve a memorandum of understanding or MOU entered into by and between the Bureau of Alcohol, Tobacco, Firearms, and Explosives, or ATF, and the Metropolitan Government of Nashville and Davidson County, acting by and through the Metropolitan Nashville Police Department to develop and implement crime gun intelligence-driven strategy between the agencies to reduce and combat gun-related violence in the Nashville metropolitan area. Item number 6, RS 2025-1118, a resolution accepting the terms of a cooperative purchasing master agreement for public safety unmanned vehicle systems and associated services for the Department of Metropolitan Police. Does anybody have anything they'd like to pull off? All right, do I have a motion? Okay, it's been moved and properly seconded. All those in favor of our consent agenda, please say aye. Anyone opposed? Anyone not voting? All right, so we recommend approval of all items on consent, and that is 8 in favor, 0 against, and 0 not voting. Let's go to, we're going to skip over item number 7, and because it kind of dovetails into our speakers today, so I want to do that one last. We'll go to item number 8, which is RS 2025-1129. Resolution requesting Mayor Freddie O'Connell to compel the Metropolitan Nashville Police Department and the purchasing agent to complete the procurement of license plate readers for use by the Metropolitan Nashville Police Department. Sponsors are Hancock and Webb. This was moved for an indefinite deferral in the previous committee. And do I have a question or comment from Councilmember Porterfield?
Move for indefinite deferral.
Thank you. Okay, it's been moved for an indefinite deferral. All those in favor? Anyone opposed? Anyone not voting? All right. So we recommend approval of an indefinite deferral, 8 in favor, 0 against, 0 not voting. All right. And we'll go back to item number 7, RS 2025-1119, a resolution accepting a donation of a life-saving medication from Hikma Pharmaceuticals USA Incorporated to the Metropolitan Nashville Police Department. Do I have a motion?
So moved.
Okay, it's been moved and properly seconded. Any discussion on this item? Any questions? Okay, all those in favor? Anyone opposed? Anyone not voting? All right, so we recommend approval. 8 in favor, 0 against, and 0 not voting. So I'm sorry, there's no, for our speakers, there's no grand amount of questions that you're going to have to cover on that particular one. Everybody's on board. So with that, we'll go ahead and transition to our guests today, specifically who are going to be speaking to some of the investment that we made as a council last year around one boxes and kind of naloxone Narcan distribution. And that's Sergeant Mike Hotz and Director of Nightlife, Benton McDonough, so feel free to come on down. You can come on, you can come right up front. Did I just hear you say snazzy? Yeah. Hot mic. It's a good thing she called you snazzy, right? I sure did. Thank you. All right. Do y'all want to test your microphones and make sure that they work? You had to turn on the little button down there. Yep. Yep. There we go. Okay. I will turn it over to both of you.
Good afternoon, Council. Thank you very much for the invite. I wanted to begin by thanking the Council as a whole, as well as particularly Councilmember Evans, as well as my counterpart here, Director McDonough, because nothing that I've been doing with this one box project would have been possible without your support, without her support, and without Benton's support as well. So thank you. I wanted to give a brief overdose update for the city of Nashville. In calendar year 2024, we saw a 31.4% reduction in overdose fatalities in Nashville, Tennessee, and that's a good thing. We haven't had many causes for hope in this battle against overdose, and 31.4% reduction is significant and noteworthy. The year prior, we did see a reduction in 2023, but it was a less than 1% reduction. So going from a less than 1% reduction to 31.4 is significant. However, I do need to temper our hope there because we are seeing numbers increasing in 2025, particularly in the month of March. We saw a significant spike on March 6th, where we saw the average number of incidents almost double in fatal and non-fatal overdoses within the city. So we were able, thanks to our partnerships throughout the community, we were able to get boots on the ground, direct action, and Director McDonough actually joined me for that outreach that we did there. We distributed 280 overdose reversal kits. Each of these kits contains 2 doses of life-saving medication, naloxone. Actually, it's the product that you all just approved the donation of 2,500 boxes of, so thank you for recommending approval on that. And each of those kits also contains literature where if somebody is wanting to receive treatment, they have resources, phone numbers, websites, places they can go to receive treatment for opioid use disorder. And they also contain test kits for xylazine and fentanyl so that people can know what they are ingesting and make that choice. During the week of March 16th to March 22nd, the weekly average for the year of 2025 is 8.3 overdose events. That includes both fatal and non-fatal. However, during that week of March 16th to the 22nd, that number jumped to 17. And then we subsequently saw that number go over 20, I believe the peak being 23. We are seeing increases in the amount of xylazine that's being adulterated into the fentanyl supply, and we estimate that there is significant quantities of xylazine, enough to produce a narcotic effect in over 80% of the fentanyl supply that's on our streets. And that's troubling because it causes it's troubling for many reasons, but it causes a dual addiction. You don't just have to treat the fentanyl or opioid addiction, you also have to treat the xylazine addiction as well. It also complicates overdoses because xylazine is non-opioid, Narcan doesn't work on it. We still encourage people to still use Narcan because it will work on the fentanyl portion of the overdose. However, there is no agonist that'll reverse a xylazine overdose, but the most troubling one is that it causes large open sores on individuals that don't cause that individual pain, so they are not typically likely to seek medical treatment for those large open necrotic sores. I'll continue to monitor the overdose situation in the city, and I will update the Public Health and Safety Council accordingly. As far as the update to the One Box program that Director McDonough and I work on, this is what the City Council invested in last year. You all approved $20,000 to purchase many of these boxes, and I am happy to say that it has saved a significant number of lives. I've installed, with the help of Director McDonough, 83 One Boxes in venues all across the city, and that's a lot. I would argue that that's probably more than any other city in the United States, although I am just speculating on that. Most recently, Director McDonough and I received permission, and we responded immediately to Bridgestone Arena, the home of the Nashville Predators, and we installed 17 One Boxes at every AED location within Bridgestone Arena. Just so you're familiar with what these One Boxes are, it's a simple kit. The kit contains 2 doses of the life-saving medication naloxone. In this case, it's Cloxado. It contains a personal protective kit that includes latex gloves as well as a rescue breathing mask. And most importantly, it has a small video screen that plays a video in case somebody witnesses an overdose.
First off, let's take a deep breath.
And it tells someone how to reverse that overdose. Another great thing about it is because we've installed a significant number of these in the music venues down on Broadway and 2nd Avenue, it contains a training mode button. So if the establishment onboards a new employee, they can press the training mode button and it will train that new employee within 5.5 minutes on how to reverse an overdose. And then also it has a Spanish language button for Spanish speakers. I have about 20 remaining out of the $20,000 that were used to purchase it. And I expect those 20 to be gone in short order. We have significant number of interest and a lot of discussions. We've also installed them in the Sounds baseball stadium, many of the music venues across the city, and we have a lot of discussions going on, which Director McDonough will address here in a little bit about other establishments and other organizations we're looking to get to on board with the One Box program. I would also like to propose for discussion at a later date for City Council. I would love to see these One Boxes installed in every Metro government building to include police stations, to include the historic courthouse, and the Birch building, as well as other buildings. And I just wanted to throw that out there. And then I don't know at what state this is, but I know there's been discussions within the council of approving another approximately $40,000 of funding for the One Boxes. I'll tell you that we definitely have over 10 lives saved just because of the One Boxes, and that's just what we know of. We don't have a reporting requirement throughout the city for the use of the drug, the life-saving medication, and that's intentional. We don't want people to have hesitations to report back to us, but I would like to ask City Council if something comes across that additional funding for these One Boxes could definitely be used, and I can definitely use it. Also related to the overdose update, I wanted to say that the Police Department Overdose Unit is sending over a proposal to the Metro Public Health Department within a short period of time to request approximately $2 million worth of the opioid settlement funds to use directly for opioid-related outreach activities. And I would like to ask City Council for their support in that matter. And then also we're in early discussions of discussing a potential sobering center for the city of Nashville, where it would divert individuals who would have otherwise gone to emergency room departments or be booked into the Davidson County Jail. And this would be a place where not only that they could receive medical treatment in a safe, clean environment, but they could also It could also be a point of intervention where if somebody needs help with opioid use disorder or substance use disorder, that we would have those resources on hand. I appreciate your time. Thank you.
Thank you. Thank you so much for all that information. I think if it's okay, we'll go ahead over to Director McDonough and any comments that you may have, and then we can take questions.
Sure. Thank you, Madam Chair, and I'll be brief. Just wanted to thank the council, Chair Evans, and also Councilmember Porterfield for the support that you all have shown us. Actually, I should introduce myself. I'm sorry. Benton McDonough. I'm the Director of the Office of Nightlife and the Metro Beer Board. Just wanted to thank everyone for the support you all have shown us in this initiative. As you know, it's very important to the health and safety of our city. It was about a year ago that I was actually speaking with Chair Evans just regarding some ideas for programming, and she asked me if I had ever met Sergeant Hotz and Trevor Henderson, who also assists us with this program. And explained to her that I've never spoken with them or met them, but it sounds like they are individuals who I would like to meet. And boy, was that an understatement. So we hit it off really well, and then we just immediately got started working with the bars, restaurants, venues downtown. And then when we met with the creators of the One Box, we started thinking about other avenues where we might be able to provide support and services for this product. And so that's when we started talking about the idea of reaching out to the professional sports teams. And we've had a lot of positive reports with them, positive feedback. And so we've started distributing and installing the One Boxes in those venues as well. I'm happy to also report that we have also been in touch with Metro schools, and they do have Narcan, I believe, in the high schools, but they also stated that they would like to see the One Boxes added to middle schools and elementary schools. So that's something that we're working on at the moment. But I just wanted to take the opportunity to thank you all for the opportunity to be here and to speak on this matter, and we're pretty excited about where we can go from here, and for the support you all have shown us so far and moving forward. So thank you.
Thank you, Director. So I'll start off. I have a couple questions, Sergeant Hotz, for you on when you were kind of going over the information about the week of, or it looks like March 16th to the 22nd, where you saw an increase in overdoses that went up to 23. I know, sometimes we've had like spike alerts or things like that kind of issued across the city, but like in this case, I don't recall there being one. Is there anything that you can attribute, I guess, around, what those overdoses during those dates were attributed to, and like, why did we see that jump?
I analyzed the data as soon as I saw that there was a statistical increase in both fatal and non-fatal overdoses. I look for geographic repetitions where if one particular area is being disproportionately affected, or if there's a particular time and space where these overdoses are occurring. This particular one was relatively widespread. The only common denominator where we saw more than one occur within a reasonable time frame was down in the entertainment district. So that's where we went boots on the ground and did overdose outreach, particularly in the unhoused communities in Old Tent City. Director McDonough and I actually did 5.7 miles on foot that day, just trying to reach out to as many people as we possibly could, distributing these overdose reversal kits. I would only be speculating as to what was causing this particular increase. But in this particular increase, there were a few similarities, most of which involved powdered fentanyl, but it wasn't one particular product. I noticed that there were at least 3 identified colors of the powdered fentanyl. There was white, green, and purple, and those different colors would indicate different sources of supply, so not necessarily one particular supply that was causing an increase like it did back in May of 2024. So I can only speculate, but I believe it was a batch of fentanyl or several batches of fentanyl that had a high concentration of fentanyl within it.
Okay. And then when you were talking about the kind of one box installations, and I appreciate you bringing one in case anybody wanted to look at actually what the tangible thing was, that was funded. But when you were talking about the installations and like your hope is that we could get to the point where we have them installed across, metro government. So it's not just like kind of the entertainment areas, but that there's also something kind of represented here. I know the very first time that I was chair of this committee, so last term, and I don't remember if I knew you then or if it was only the Trevor Henderson at the health department that I was talking to. There was this kind of discussion about like, could we do something? It wasn't the One Box brand, it was some other brand, but do those installations like near the AEDs. And I had gotten some kind of initial pushback, and this was under a different leadership from General Services about the idea of like, how would we make sure that we needed to replenish the naloxone, that kind of thing. And now that you have had this experience with doing all these installations and, that you've done so far, do you have any thoughts about from a process perspective, like how are you maintaining, these kits? Like I know you've said some have been used. And so how did you learn that they had used them? Do you go out on a regular basis and kind of check?
So I personally do not inspect these units, and that's intentional on my part. The very slight burden that it is incumbent on the management of whatever venue or facility they would be installed at. But I do track where I install these and how many I install. And I just use a simple Excel spreadsheet. It's got a few different fields in it, and it's very easy to check up on it. And I let the management know that if the naloxone is used, or even if it's stolen, which in my personal opinion, that's just more doses of naloxone that are out on the street for somebody who needs it. If you're stealing naloxone, you probably have a significant need for it. That I'll replace it, no questions asked. I will drive to whatever location it is and drop off another 2 doses of naloxone for them. I just don't want them to feel that we're going to be digging for answers related to an opioid overdose in the worry that it would have a negative impact on that person's private business itself. But I do make it available if they ever ask.
Okay, thank you. And then when you were talking about the installation for like the Sound Stadium and Bridgestone and, other sports venues, are there any that haven't done it yet that we should advocate that they also take advantage of what you're doing?
We've had positive discussions and meetings with the Nissan Stadium and the Titans, but I do have to report in the interest of full truthfulness is that we haven't installed them in there yet. I don't know what the issue is. It doesn't seem to be like an outright opposition. It just seems to be more like a scheduling issue. We'd love to get it into both the old Nissan Stadium as well as the new stadium under construction, as well as Geodis Park. We've had agreements via email to install them in Geodis Park, the home of the Nashville Soccer Club, but in the interest of truthfulness, we haven't had them installed there yet. So we would like to see that. And then just as another cause for hope, we've also had very positive conversations with WeGo, and we're in the very beginning stages of a pilot program where we would install One Boxes on WeGo buses, as well as transit hubs that are in need.
Okay. And then lastly for me, and then we'll see if anybody else has questions. If we have a venue in our area that we're like, we frequently go to, we would like to see if they're interested and they are interested in installing. How do we facilitate that? Do we just get them in contact with you?
Yes, ma'am. I believe if you were to provide them my email, which I believe you already have, but for anybody who doesn't, it's michael.hotz, H-O-T-Z, at nashville.gov, and I can facilitate those discussions. And a lot of my counterparts kind of make fun of me, but I offer to install them myself. I worry sometimes that a business will agree to install them. And if I was just to drop off a one box, that I worry that it would end up in a drawer somewhere collecting dust and not saving anybody's lives. So I always offer to install them. I have a orange Home Depot bucket and a DeWalt drill, and I've installed almost all of the 83 that we've installed across the city so far. So please email me, and I'm happy to facilitate those installations anywhere across the city.
All right, thank you so much. It looks like Councilmember Huffman has a question, so let me recognize him.
Thank you, Chair and Director McDonough. Sergeant Hotz, thank you very much for coming. First time I've ever seen you in a suit, so I didn't recognize you at first.
It's out of the utmost respect for the council, sir.
Well, I really appreciate that, and just to reciprocate that, you yourself, I've got the utmost respect for. You yourself have saved countless lives. I spend a lot of time in the unhoused community, and you have really made a difference there. So I just want to highlight that before I get into any questions.
Thank you, sir.
Couple questions regarding the finances of this. Do you recall what one of these costs per unit is?
So back when council approved the previous $20,000, they were about, I believe they were $199, so roughly $200 a box. But I've worked so closely with the West Virginia Drug Intervention Institute, who is the manufacturer of the one box, where I believe I can get them for approximately 150 at this point. And this is just speculation on my part. I believe if we were to buy a significant quantity of them, I believe they would agree to drop that price even further, sir.
Okay, great. Thank you. Is there any shelf life? I recall that there is, but I can't remember what it is.
Most naloxone products have a shelf life of about 3 years. It's printed very clearly on each individual dose of naloxone, and that would be incumbent on whichever organization or business or institution agrees to install these in their locations. The video screen that's in there, it comes with a charging cable that needs to be charged about 3 times a year. So what I tell, most business owners is just have somebody's job, usually a manager on duty or a business owner, just once every 4 months or so, check that the video screen is working, check that the naloxone is there, and check the expiration date of it.
Thank you. And just one last question around the use of xylazine. Really seen that pick up in our neck of the woods in Hermitage as well with the unhoused population. It's really tragic that Narcan is not effective on it. I have seen reports of other things such as Yohimbian being particularly effective. I don't know if you've had any discussions with the health department around that and treating it or where that stands.
My discussions with the health department have been limited, but other partners throughout the community, our general game plan is to, number one, provide them with xylazine test strips, which are generously donated to me. I've become very adept at begging and borrowing for both naloxone products itself, but also the test strips that we need, and I've been successful so far. As well as working with our partners, and I found success in finding wound care kits, which contain a lot of things, but gauze and a petroleum jelly type product that can help clean, as well as some way of that for them to clean. But you are correct, council member. It has gotten bad to a point with the xylazine and the xylazine wounds that I felt compelled several months ago to ask my chain of command if I would get permission to attend EMT school. And I'm happy to report that on April 21st, I'll be starting at the Nashville Fire Department EMT school so that I can help these individuals if they refuse medical treatment, which a lot of them do because it kills the nerve ending and it doesn't hurt in most circumstances. When I'm out in the field doing outreach, I'll have the skills and the training to at least, do a little wound care out there for them and possibly prevent amputation.
Thank you for that. And the treating of the care of the wounds is something that just cannot be just overemphasized enough. And thank you for doing that. To any outreach groups that are listening in, please, if you see somebody that has an open wound, take that very seriously. Thank you.
Thank you, council member.
Can I ask a question kind of related to the EMT school thing? Is the department, I would assume, paying for that? That's not something you're having to do at your own expense, is it?
No, ma'am. We work very closely with the fire department. The police department and the fire department have a very close relationship, and the fire department has very graciously allowed 4 police department individuals, one from the SWAT team, one from the bomb squad, and one from our Titans teams that does high-risk arrest type situations, and also myself at the overdose unit. So 4 of us will be attending this 3-month-long course and at no expense to the city.
Okay, thank you so much. And it looks like Councilmember Prepty, you're recognized.
Thank you, Madam Chair, and thank you both for being here and presenting today. I've got a question relating to a substance that's been identified by the previous administration under the FDA as posing a pretty significant risk of overdose. The substance is generally marketed as like gas station heroin or alternative to opioids. It's tianeptine. And again, it's been identified as having a very significant risk of overdose and dependency. And I know that there have been other jurisdictions like New Jersey that have had increased enforcement around getting tianeptine off the shelves because oftentimes it's marketed as a dietary supplement as well. Have we seen any issues in Nashville as it relates to that specific substance?
I'm happy to report, no, sir. We have not seen it specifically here in Nashville, but that doesn't mean it may not come in the future. As you mentioned, it has showed up at gas stations in New Jersey, and there's been a predominance of it in Alabama and Georgia as well. It does have a significant risk of overdose, non-opioid overdose, and also runs the risk of causing psychosis in the person that does it. But as always, if there are any instances of this, another nickname for it is Zaza Red. If it happens to show up within the city, I am happy to investigate that thoroughly, and my team would take that very seriously.
Wonderful, thank you. And then you mentioned non-opioid overdose with these specific kits that we're distributing around the city, and talking about providing folks access to Narcan and other anti-overdose drugs. With these specific kits and with the drugs and with the anti-overdose drugs that we just approved the donation of, do those work on non-opioid overdoses, or do we need to sort of broaden the scope of access to resources so that we can address both opioid and non-opioid overdoses?
The only thing that naloxone products, whether it's Cloxato or Narcan or any of those, the only overdoses that they reverse are opioid overdoses. I didn't realize when I was asked to create or to help found the overdose unit over 5 years ago, how many people in our city actually die of other overdoses that are non-opioid, such as cocaine or methamphetamine. And to my knowledge, there is no drug that will reverse a cocaine overdose or a methamphetamine overdose because it usually causes significant heart issues or even strokes. In my personal opinion, the only successful intervention for an overdose of cocaine or methamphetamine would be immediate medical help from medical professionals. So I don't believe there's a drug that would reverse them.
Okay, thank you so much.
Thank you, sir.
Thank you, Councilmember Prepty. Any other questions? Councilmember Nash, you're recognized.
Thank you, Madam Chairman. I must find I'm alarmed and shocked that schools feel like they need them, especially in elementary schools. And I guess I'm wondering, is that a function of the children finding drugs at parents' home, or is it we've got events going on with people of adult age or thus that would be maybe using drugs? Your thoughts?
Councilmember, it could be due to a significant number of possibilities. I would say that the most common one of these possibilities relates to the prevalence of counterfeit fentanyl pills on our streets. we've interdicted significant quantities of counterfeit fentanyl pills. And these pills are made to look like legitimate prescription pills, such as OxyContin or Xanax are the two most common ones. The blue M30s and the Xanax-shaped counterfeit fentanyl pills are the most common. And if you bear with me for less than a minute, I can kind of drill down and give you an anecdote that would help you discuss with your constituents. So they did a study of the pills that were seized in calendar year 2023, and this is on a federal level. And they found that 42% of the pills that they tested had greater than 2 milligrams of fentanyl in it. So to drill down on that further, if somebody does not have a built-up tolerance to opioids, 2 milligrams of fentanyl will kill you. If you have a built-up tolerance, it may not. So if you drill down even further on that, and teens and their attitudes towards the recreational use of prescription medication, most teens believe that it is inherently safe to use prescription medication recreationally. And I would speculate that's because, well, it came from a doctor that couldn't hurt me. So if you drill down even further on that and think about teenagers, I'm the father of 3 teenagers, so I can testify in front of council to this. They don't always make the best decisions and don't always have the best impulse control. And if you drill down further on that, if one of our teens or younger adults has a lack of clarity in a particular moment and decides to make the poor choice of taking a prescription pill recreationally, that prescription pill is most likely going to be a counterfeit prescription pill. So to drill down the final time, if one of our teens or anybody in our community doesn't have a built-up tolerance to opioids and they make a poor decision to ingest one of these counterfeit fentanyl pills, they have a 42% chance of dying. And that's a shocking statistic. And we just want to enable all of our educational facilities to save somebody's life if it needs to be saved.
Thank you. Have we had an incident yet of a child in an elementary school having an overdose?
I don't have the answer to that, sir, but I could look into it and report back.
I only say that because there are a limited number of these boxes, and I think we need to be very strategic about where we put them, where they're most likely to be needed and used. And again, elementary schools, there may be an event after school where you got people that are teenagers attending, and so I don't want to necessarily question the being delivered there, but I'm just curious what gave rise to that discussion. Thank you.
Thank you, Councilmember.
Councilmember Chair Porterfield, you're recognized.
Thank you, Madam Chair. Thank you for this very helpful information. And to kind of piggyback off of Councilmember Nash's concerns, we can also look at facilitating if MNPS can cover some of these boxes in their own budget, because they do have a sizable budget. So, it may be more prudent for us to allocate funding for these one boxes through your program in one manner, and it may be more prudent for MNPS to use some of their funding to also put one boxes in their schools. But thank you for being willing to participate, and we do want to support getting them everywhere that they need to be. So if they feel like it's valid and they need to be there, we definitely want to support that, but there may be a better budgetary way to do it.
Thank you, Councilmember. And just so you know, before we implemented in the installation of these boxes, we were very cognizant of the financial investment that the city made in it, and between Director McDonough as well as our other problem-solving partnerships across the city and state, we've essentially come to the determination that if it is a small business with not a lot of financial resources, that is the kind of business that we would facilitate the previously purchased, the boxes that are funded by the council, and larger organizations that have a more significant cash on hand or ability to pay case in hand, like Bridgestone Arena, they would purchase them themselves, so that we would very much respect the council's allocation of funds.
Thank you, Chair Porterfield. Have any other questions? Councilmember Bradford.
Thank you, Chair. You mentioned earlier your outreach with the unhoused community. The questions around that is, have you reached out to some of the organizations that provide shelter to have some of these boxes installed, or is it just you're going out to the camps and handing out the naloxone?
It is all of the above, sir. I will speak to and work with anybody who shares our shared mission of ending overdose and saving lives. We've had discussions with getting one boxes into the cold weather shelters. So far, we've been able to provide them with naloxone, so they have Narcan on hand, but not necessarily a one box. And any of the organizations that cater to the unhoused population within our city, I believe I've probably spoken to the vast majority of them, and I believe they all know that I'm on their team, and all I'm trying to do is keep people from dying.
I appreciate that. Thank you.
I just wanted to add to that I feel like it's important that we also have the one boxes on hand so that if an individual does come across someone who is going through an overdose at the time and there's no one there that knows how to address the issue, that they have the training video on there that they can watch that provides them with guidance on how to distribute the Narcan to the individual. So that's why it's so important that we use the one boxes, but also the naloxone and the Narcan that's available.
Thank you, Director, and thank you, Sergeant Hotz. Any other questions for either of them? All right, well, I really appreciate your time today. Thank you so much for coming and sharing kind of the great work that you're doing. And I think it really illustrates like when we make modest strategic investments, that they can be impactful. So I appreciate your time. I'm going to give any departments an opportunity to update. And I know we've got Metro Health. Do you all want to give us any updates on anything? Not even in light of the CDC grant? No, I see head shaking no. Now he's shamed into coming up. Mr. Sharp. Oh, hang on. I'm sorry. There we go, Mr. Sharp.
Tom Sharp from the Health Department. I know we've all seen a lot about the cuts at the federal level. So far, the primary manifestation locally has been that some of the larger grants are coming in partial amounts while they review the language that's in it. We don't really know what's going to happen. Ryan White is one of those. There's a couple of others. The same thing is happening there. They often come in sort of dribs and drabs, but they're coming in smaller initial amounts at least. And Ryan White is on an odd fiscal year. It starts March 1st. And so we got a partial board, which you guys have already approved. Thank you. But we don't know what's going to happen. And that has been, we did lose when they ended, the CDC ended 2 programs just out of the clear blue sky last week. We had to lay off 5 people. We found one of those, another spot in the health department, and working to try to find them places to work elsewhere in Metro if we can. So that was really a pretty miserable day. And we all assume that there's more to come. You just don't know. And the implications of all the staff cuts at the HHS, my guess is that some of the biggest problems with those will be the communication that we have with the grantor. If they're understaffed up there, it may just get harder to get our questions answered about what we can do and what we can't do, what this means, and various and sundry things like that. Right now, the biggest actual things were those cuts from last week and the 3 grants that have come in a much smaller initial award, but we'll see.
Thank you for that. Ms. Leach, did you have anything to add or? Oh, I'm sorry. Is that Dr. Melville Chester? I can't, it's like my vision, once I get past a certain point, I'm like kind of looking at shapes. So I'm sorry. Dr. Melville Chester, do you have anything you'd like to share? And thank you, Mr. Sharp.
It's just the hair, that's what. I will say that we did not experience any cuts. One of the grants we have from BJA that we were worried about was our Community Violence Intervention and Prevention Grant, but we received notification that it's untouched and we're not going to suffer any loss there. So that continues, which is great. But if we lose one employee, we lose one too many. So because we're talking about individuals and families, and the impact there is felt by all of us at Metro Public Health. But like Tom says, we're doing everything we can to ensure that we try to place individuals different places in Metro and ask to prioritize their employment across, the Metro system so they will have employment.
Thank you for that. And will you also give everybody the update about your event on April 21st?
I was just about to do that.
Okay,
Thank you.
great.
We are excited about our second annual Behavioral Health and Wellness Summit. That will be April 14th. Breakfast is from 7 to 8, and then the summit is all day long. We're excited that our keynote speaker is Dr. Carlton Moore, who was the director of BJA before the new administration take over. I met him in Chicago. He was dynamic, and so we got to have him to come in to do a keynote, and then we'll be doing a call to action beyond words, call to action for the community, fostering resilience, building safety and empowering wellness in our community. That is our conference this year. And I'm excited because as of 2:00 this afternoon, we have 541 individuals registered to attend on the 14th. So these are exciting times, and thank you for your support as a council, for everything you do to ensure that at Public Health and the Division of Behavioral Health and Wellness, we can keep doing this work in the community. And I also want to add, as we're talking about naloxone, that we also distribute naloxone kits in the community at every event that we go to. And we have 3 1-boxes that we're looking at spike alerts and looking at the data to determine where those will be installed in the community.
Very good. Thank you so much for those updates. And that's exciting about the 541. Councilmember or Chair Porterfield, do you have a question?
Oh, no, just a.
Oh, okay. Thank you. Okay, no question. Okay. Thank you so much, Dr. Melville Chester. I'll just add that I guess kind of a direct impact on the CDC cuts that Mr. Sharp was talking about is we lost the 2 positions in the health department that were helping with the project management and process for the shelter pods. And so you may have seen that on the news on Friday, that basically the pod project, we're in a little bit of a regroup stage now, which is unfortunate because we're getting very close to kind of some more public information on the RFP and everything related to organizations and faith communities that may have an interest in applying to take on some of the pods. So we're regrouping this week, and then hopefully we'll have another point person kind of established on who's carrying us forward. So it kind of shook us up just a little bit in the process. But I'm confident we'll get back on track. And then Chair Porterfield, I'm happy to recognize you.
Thank you, Chair. I did just want to share a quick announcement that I thought this committee might appreciate. On Thursday, April the 3rd at 6 p.m. at Otter Creek Church, a Bigger Vision Films will be screening Beyond the Bridge, A Solution to Homelessness. So it is a free screening and panel discussion. So it will be a movie that will play. They are showing this in cities around the country, and Nashville was one of the cities that was chosen. There will be a panel discussion with myself and April Calvin and a few other people from Metro there. So if any of our colleagues would like to come and hear about one possible solution for homelessness and to serve our unhoused community, please come out.
Thank you so much, Chair Porterfield. Anybody else have anything that they'd like to share with the committee? All right, with that, we're adjourned.